What if I tell you, if you learn one skill, that will save many lives? Yes, if you know to interpret ECG, you can save many lives. So today's topic, we're gonna discuss about basics of ECG. I am Dr. Naveen. I work in here. Welcome to my YouTube channel, MedVest. Are you ready to save lives? Let's get started. So today's topic, we're gonna see about some principles of the ECG, and we're gonna learn about the conduction system of the heart and lead placement on the body and ECG graph boxes. So ECG works by the principle of galvanometer. This device is also called as voltmeter. So it's a simple device. It will detect the electricity flows across the circuit. So there are many electric pathways in our heart. We'll take this one pathway for an example. And if we measure this one single vector by placing electrode over the heart, if the vector passes towards this electrode, in ECG it is represented by the positive wave, which is facing up. And if the vector goes away from the electrode, then in ECG we'll be seeing the negative waves. So by this various electrical activity, we are getting more positive and more negative waves in ECG. In state of depolarization, the vector which is produced is positive action potential. When a positive action potential moves towards the electrode, you will be having the positive deflection. When the positive action potential moves away from the electrode, you will be getting the negative deflection. Whereas in repolarization, the vector which is created during the repolarization is negative action potential. If a negative action potential moves away from the positive electrode, you will be getting positive deflection, just opposite to the depolarization state. If the negative action potential goes towards the electrode, you will be getting negative deflection. With this basic concept, we will move to the conduction system of heart. So initially, this SA node is also called as the pacemaker of the heart, will produce the positive action potential. This action potential reach the AV node. Once the action potential reach the AV node, after a 0.09 seconds delay, it will pass on to the septum of the heart. Initially to the left and to the right, and further this action potential passed to this ventricle by Purkinje fibers. The action potential is traveling from SA node to AV node via this right and left atrium. This electrical activity inside this particular part of the heart is represented in ECG by P wave, which is a positive wave, and it represents the atrial depolarization. Once it reaches the AV node, there is a delay in the conduction in AV node, that is 0.09 seconds delay, right? That is represented in ECG by this PQ interval. And once it reaches to the ventricle, it is represented in ECG by QRS complex. It represents the ventricular depolarization. The negative action potential is represented in ECG by T waves, that is positive wave, which is ventricular repolarization. So what you are seeing here is 12 lead ECG. It's one of the most common. If you look closely, each leads are labeled. This is lead 1, lead 2, lead 3, and this is augmented vector leads AVR, AVL, and AVF. So these are all limb leads. The other 6 sets of leads are called precardial leads: V1, V2, V3, V4, V5, and V6 are all precardial leads. So V1 is placed over the fourth intercostal space near to the sternal border on right side, and V2 is placed just opposite to the V1 on left side. V4 is placed on 5th intercostal space in mid-clavicular line. V5 is placed on 5th intercostal space on anterior axillary line. V6 is placed again on 5th intercostal space in mid-axillary line. Each lead is capable of measuring the electrical activity inside the particular region of the heart. For example, this V1 and V2 are measuring the electrical activity in septal region of the heart. V3 and V4 are measuring the anterior part of the heart. V5 and V6 are measuring the electrical activity in the lateral part of the heart. R wave in V1 is smaller, whereas in V6 the R wave is tall. This is because the lead V1 placement is parallel to the vector direction, and V6 is just perpendicular to the direction of the vector. So the flow of the positive action potential towards the V1 is less than the V6. This is the reason why we are having this R-wave progression. Here in this example, this is a normal person ECG. You can see this R wave, that is the most positive wave, the tallest wave in ECG. And if you count the large box between the RR interval, you will be having 1, 2, 3, 4 large box. If you divide 300 with the number of large box, you will be getting this heart rate. In this example 1, we are taking this lead 2 to measure the heart rate. In the lead 2, you can see this RR interval. And if you number the large box between the RR is 1 and 2, if you divide is this 300 by 2, you will be getting 150. So the patient is in tachycardia. So if you just look at this overall ECG, you'll be having lot of beats. So this patient is in tachycardia, and also this RR interval is equal. So this patient has sinus tachycardia. If you measure this RR interval in lead 2, you'll be having 1, 2, 3, 4, 5, 6, 7. So if you divide by 300 by 7, you'll be getting 42. That is bradycardia. And if you look at this RR interval, which is equal in throughout this lead, so the patient is in sinus bradycardia. So another important feature in ECG, you can easily see the rhythm of the heart. If you look at this closely, this lead 2, the RR interval varies. So opposite to what the example we have seen before. There the RR interval is similar in sinus brady and trachy. Here the RR interval varies. If you look closely, there is one large box, and here is 2, and here is 1, 2, and 2.5. So here is 1, 1.5. So this is a clear example of atrial fibrillation. This is another example where you can clearly see this RR interval varies on this lead 2. There is no P wave before QRS complex. These are all the fibrillator waves. So this patient is having the atrial fibrillation. Thank you for watching this video, guys. In future videos, we'll be discussing about various heart pathologies, ECG, example, myocardial infarction, ventricular tachycardia, atrial fibrillation. So please do subscribe my channel. This is Dr. Naveen signing off. Have a good day.